Imagine waking up in a hospital bed, but something feels wrong. Your legs fractured, your nerves damaged, your dream of walking taller shattered. Sounds like a horror story, but for some patients who undergo limb lengthening surgery, this is a harsh reality. What happens when this miracle surgery goes horribly wrong? Let's find out. Hi everyone, I'm Dushyant Maggu from MedSurge India, your guide through today's very important discussion. Limb lengthening surgery is not some kind of a magic trick. It is a medical procedure where doctors literally break your bone and then slowly pull the two pieces apart using a device. As the gap widens, new bone tissue naturally fills in, making your leg longer over time. Imagine it using a jack to lift a car. Only here it's your bone being stretched a tiny bit every day. Some people do it to correct deformities from accidents or birth conditions. Others, especially adults, choose it cosmetically to gain a few extra inches of height. Sounds fascinating, but it's not without a risk. Let's find out where things get scary. In some cases, the bone don't heal properly, a condition called non-union. Imagine stretching a rubber band so much that it snaps. Instead of solid bone, you get a weak, unstable leg that may need another surgery to fix, or sometime even a metal rod for life. Then there is a nerve damage. Stretching does not just affect bone, it pulls on nerves too. One small mistake and patients can end up with foot drop, where you physically cannot lift your foot while walking. Infections are another huge risk, especially with external devices being used. According to 2021 review published in the Bone and Joint Journal, up to 30% of patients experience complications like infections, non-union or mechanical problems during this procedure. And it is not just the body that suffers. Mentally, limb lengthening can be brutal. The recovery often takes 3 to 6 months, and during that time, you might be stuck using crutches, walkers or wheelchairs. Loneliness, depression and even regret are common. So why do these problems happen? Sometimes it is a surgical error. Inexperienced doctor performing complex procedure they are not fully trained for. Other times patients travel to cheap clinics overseas where doctors rush through 5 or 6 surgeries a day like an assembly line. Less care is more risk. Unrealistic expectations also play a big part. Some patients push their body too far, asking for 8 to 10 centimeters of height increase when their tissue can barely handle 5 or 6 centimeters safely. And if you skip critical physiotherapy after surgery, congratulations, you have just increased your chance of complications dramatically. Now let's be fair. Not every story ends in disaster. With experienced orthopedic surgeons, proper planning, and strict rehab, many people recover successfully and live better lives. Here are some steps to help ensure a safe and successful procedure. Choose a hospital with a dedicated limb lengthening unit led by a senior orthopedic surgeon who has extensive experience in deformity correction and cosmetic limb lengthening. Always ask, how many limb lengthening surgeries have you personally done? Look for at least 30 cases, not 5 or 10. Demand to see a full rehab and physiotherapy plan before you even book surgery. Make sure the clinic offers mental health support because recovery is much mental as physical. Check the hospital's infection rate and ICU facilities. Complications can arise. Make sure the center is an accredited one. Insist on a detailed cost breakdown. Cost for surgery, physiotherapy, accommodation, transportation, and caregiver expenses if it is required. Confirm availability of advanced external or internal fixators. Reliable hospitals use FDA approved or certified devices like Precise or Elizarov systems. Look for in-house physiotherapy facilities. It is a red flag if rehab is outsourced or optional. It is mandatory for full recovery. Ensure language support for international patients. Good hospitals offer translation help, especially in medical context. Understand the timeline honestly. Any surgeon promising 6 inches in 3 months without discussing the risk is likely overselling. The realistic recovery timeline is generally 6 months to 12 months for full results. Watch out for medical tourism traps. Avoid small, flashy clinics promising overnight miracles. Stick to Tier 1 hospitals with multidisciplinary clear team. Check if the orthopedic team is supported by endocrinologist and nutritionist. Hormonal balance and proper nutrition play a big role in bone healing. Think of it like buying a car. You would not just walk into any shady dealership. Same logic is applied here. Your body deserves even more careful research. Before you go, if you have considered limb lengthening or know someone who has, drop a comment below and subscribe for more healthcare awareness content. Until next time, stay healthy, stay smart, and stay connected with MedSurge India.